Hi, my name is Anita Chan. I'm the program coordinator at Arthritis Consumer Experts. I'm here today with Michael Vallis. So Michael, can you provide our audience with a short introduction of yourself and what you do?
Sure. So I'm a health psychologist. So my interest is in supporting the emotional, behavioral quality of life of individuals living with chronic disease. And so I'm here to talk about how physicians, nurses, healthcare providers can really be more supportive of patients living with chronic disease, living with arthritis, living with other rheumatological disorders, in terms of how they can make the changes that would produce not only the best medical outcomes, but also the best quality of life outcomes.
What do you think is the most exciting thing from this year's CRA meeting?
I think that the spirit of collaboration for me is, I think, amongst the best, is that people are really open to learning from each other, really coordinating care. And one thing we've not done well, I think, in the past has been operating in silos, so everybody's operating independently. I think what is really exciting about the contemporary practice is that people are very interested in starting to collaborate together, and importantly, bringing the individual into that team so that the outcomes will be much more guided by individuals' needs and resources.
What do you think about the use of social media in relation to patient care and medical research?
So I think that's a fascinating question around social media, because I think we're frightened by it, but the world is changing so quickly towards the integration of social media that it's just inevitable. And I think we need to figure out how can we support the use of social media in a way that is both ethical and also maintains patient confidentiality. So it's a challenge, but I think it's here.
Yeah. You just finished a talk on motivational interviewing. Can you describe what that is and how it would benefit the patient-doctor relationship in rheumatology?
Absolutely. I think that, in fact, it's about the patient-doctor relationship. So, in a nutshell, what doctors, nurses, medical providers are really good at is teaching and telling. And they are very concerned about the patient's welfare, but they come from the perspective that the best way to achieve outcomes is to make recommendations, to provide the education. What I'm here to do is to help them realize that they need to be more collaborative. So it's not about teaching and telling, it's about collaboration and empowerment. And motivational interviewing is a series of communication strategies that really allow the patient and the provider to understand each other and to negotiate, so that when choices are made for treatment, that the individual patient is much more engaged, much more in charge, and therefore going to be much better able to follow through and integrate it into their life.
What are some success stories in relation to motivational interviewing?
I would say for both patients and providers, they describe it as liberating. And what I mean by that is that patients feel that they've finally been heard. So there's a sense of, like, okay, thank goodness, you understand. They feel very relieved by that. And providers feel liberated because they feel that they don't have to solve all the problems. So they don't have to be the expert. If they don't know, they don't need to know. So the one word that we hear consistently is that people feel much more liberated. And ironically, that gives them more room to move. So they're more flexible.
How long do you think it will take for clinicians to adapt this to the method and into the practice?
So I think it's the changing physician behavior is exactly the same as changing patient behavior. And so right now we have a number of providers who are very ready to change. So they already understand this. They're very interested in receiving training. They're very ready. Other providers, not so much. So I think, like many things, it'll be starting with those people that are ready and then encouraging others to come along.
So is it going to become medical students' curriculum, do you think?
Absolutely. It's already embedded into the medical school, and so I just see it more and more becoming part of the... We're already seeing young doctors, newly graduated doctors, who are already already using these strategies.
Okay, that's great.
Yeah.
And I understand you have a website that tells us more, and you also have posted some helpful videos on there.
Yes, that's right.
Do you want to tell us what that website is?
Yes, so it's www.behaviorchangeinstitute, is one word, spelled with a U, .ca.
Michael, do you have anything else you would like to share with patients or rheumatologists?
Well, I think in fact that what I'd like to say to patients is bear with us. Don't give up on us. I think we're starting to understand that in fact your voice is the most important voice that we need to start with. And so I think the message to patients is that receptivity is improving, and so it will be, I think, useful for people to really become confident that they can take charge of their health. And for healthcare providers, I think to reassure them that a collaborative approach will be in everybody's best interest.
Great, thank you so much, Michael, and I wish you safe travels.
Thanks very much.